Hi, my name is Emily Greenblatt, and my project topic is spreading ADHD awareness in the classroom. I chose this topic because I struggled a lot with ADHD growing up throughout my my career here at JD. And I spent a lot of time feeling like I wasn't good enough or I wasn't smart enough and I was behind everybody, and no matter how hard I tried, I couldn't pay attention to the teachers and the students, and it just made me feel like I wasn't good enough in general, which is not a good feeling. So I wanted to help other students with ADHD and give them more resources to help them overcome their ADHD and help them not have to go through that kind of stuff. So my research question was, how can we help students with ADHD feel more welcome in school? So what I did for my final project was I created a website containing some resources for pretty much anyone, students, teachers, parents, people know someone with ADHD. But this website included a brief summary of ADHD statistics, donations to different ADHD support groups, and I interviewed 3 people. I interviewed Miss Howe, the school psychologist, and we talked about executive functioning, which is something that students with ADHD struggle with a lot, so we talked about different strategies for executive functioning, and kind of a brief overview of what it is. I interviewed my mother about raising kids with ADHD from a parent's perspective, so we talked about some overall strategies for helping these children, and like what worked and what didn't and that kind of stuff. And I interviewed Katie Daly, who works at Upstate. She's the coordinator of the Disability and Support Services program at Upstate. And I talked with her about accommodations for ADHD and being able to get help when you need it, because a lot of students don't like to ask for help, or they're skeptical about asking for help, and sometimes taking that first step and asking for help and admitting you need help can be a challenge sometimes. So I talked with her about how to encourage students to get more help. My main takeaways, some things I learned a lot of. I did have kind of a first-hand perspective going into this project because based on my experiences with ADHD. So I kind of was able to learn about other people's perspectives and how everyone is different, and I also got to learn a lot of public speaking skills. And I'm a person who doesn't really like public speaking. I don't like being the center of attention. So getting more practice doing that was nice. So I also think that for any upcoming students taking this course, I think it's important to start your project as soon as possible. I think for me, I spent a lot of time doing research for the project and not thinking about what I wanted that final project to look like. So I ended up going back and forth on what I wanted it to look like. I had a bunch of different ideas at different times. And by the time I got to my final idea, I didn't have as much time to complete it as I would have liked to. And I completed it successfully, but it would have been nice to have more time to complete it. So that's my advice for upcoming students, and just be confident in your research and your progress. I think for me it was helpful to think about how far I've come rather than how far I still needed to go with my project. So, yeah. Starting off, can you tell us what is executive functioning?
So executive functioning, I like to think of it as the conductor for an orchestra, because it manages the functions of the brain in terms of 3 essential components of working memory, activation, and then inhibition. So when we're thinking about ADHD, typically you think of having a short attention span. That's kind of the classic thing. Well, what does that impact? Well, it impacts what you can remember, because if you're not focusing, you're not remembering. It kind of slides off the Teflon pan. The other part is the activation. A lot of times with executive functioning, students struggle just to get started. So when you think of the orchestra, it's like the conductor's there and he's pointing to you. You're on, you're gonna play now. So being able to get that together, to get going, to do and perform. And then the inhibition part is where you are kind of knowing when to speak, when to come into play, when to hold back. So think of that as your volume that the conductor is saying more and more and more, like louder, you know, and then coming back. It also looks at, when you're thinking of your attention, how are you, when do you respond, when don't you respond, when do you hold back? So looking at those three components is looking at that executive functioning. And then the main thing that you also think of is planning and organizing and getting things done. So here at the high school, some students really struggle with that task completion, and they might complete the homework, but then they don't turn it in. So that also comes into play, as well as when you're thinking about larger projects and how to get started and stay on top of things. So all of those are required for an executive function.
And why do you think children with ADHD struggle with this set of skills?
Because it's hard when you have ADHD to concentrate and focus. So you need that in order to then know how to plan and organize. If you're not focusing and remembering, it impacts all of them. So I see executive functioning as kind of being farther down the line. So first you need to be able to attend, then you need to remember, and then you need to put it all together to get something done.
So you've seen a lot of ADHD students.
Mhm.
What are some effective strategies for improving executive functioning skills for these students?
So there are a lot of things that you can do when you struggle with executive functioning. So one thing that I like is using a planner or a calendar. I think kids are tired of teachers saying, take out your planners, but it is the most effective way to stay on top of things. It also helps improve your ability to remember it because you're writing it down. So it's kind of a combo of using those planners as well as writing things down. And then there's some trace as to, well, what was that assignment? Yes, we use Google Classroom, but in life there are going to be things that you need to write down. So it's recorded somewhere, so you can go back and see, oh yes, I have that. I also like checklists because when you're thinking of any kind of task that you're trying to accomplish, being able to have a list of things and checking things off, it shows your progress. And I like visuals. I think visuals in general are a positive thing to use when you struggle with executive functioning. And it's also rewarding, so as you can see that you're making progress, whether you're doing a timeline and breaking things down, you're seeing that progress. Whether you're putting that down into segments on your Google Calendar and seeing that, that's another thing. And then at each of those points, when something is done, a small part of that, reward yourself, because then you're more likely to do this again. The other thing that is huge is routines. So once you have kind of trained yourself into a routine, it requires less thinking because it becomes automatic. So that's a key component for making any kind of life change, is getting it into your routine, whether it's taking your vitamins or brushing your teeth and remembering to floss, or even being organized in terms of that routine of, okay, I'm always going to put my car keys here. I'm going to put my student ID here so that when I'm going out the door, I have it. I think of, your backpack, packing it the night before and it's there by the door to go so you're not running around, oh my gosh, where's my chemistry book? You already had it packed and it's there and ready to go, and that's part of your routine. Setting up a time when you usually do your homework. So sometimes to start that routine, sometimes you have to start small. It might be for some kids who aren't doing any homework or anything, set an alarm. What's a good time to set that alarm? Well, maybe it's 7 o'clock because we've already eaten dinner. If I have an alarm that goes off, it might just remind me, oh, I should get out my backpack and I should look at my calendar and see what is due. So starting with those little things, those routines, and reward yourself. I'm big on rewards, whether that's okay, I'm gonna get a snack, I'm gonna, do a 5-minute thing and chit chat with my friends, or check Snapchat or whatever it is you're using, just to kind of reward yourself, but then get back. Also I'm key on timers, like 20 minutes on, a couple minutes of reward to shift that focus, or shifting doing something difficult to then doing something easy. So if you know it only takes you 10 minutes to get your math problems done and you've been working hard at something, to then finish, do those 20 minutes and then, okay, I can knock out those math problems. That's an easy check, getting it done. So those are some positive things that you can do to help. Another one is, being able to verbalize, what is my goal? What do I want to accomplish? Whether you're talking to a friend or if you're writing it down. So what is it that I want to accomplish and what might be some stumbling blocks along the way? And just so you're kind of talking it through before you actually get started, it can also help. So those are some suggestions.
So now before we wrap things up, you and I met back in October, and we talked a lot about different situations that students with ADHD have gone through, like having to stay after school to complete a project, because sometimes it takes these students a little bit longer and stuff like that. One thing you said though that really caught my attention, and this is a direct quote from October, was students with ADHD tend to get a lot of negative messages, such as try harder, focus, etc., which can wear someone down after a while to the point where they don't feel like they're good enough. This stuck with me, I feel like, because it's such a great insight on how ADHD can affect an individual's self-esteem. And I wanted to bring this up because there are some connections between low self-esteem and executive functioning, and there have been some studies that have shown that people with lower self-esteem have struggle with executive functioning to a greater extent. So is there anything else that you can think of that may affect a student's executive functioning skills?
Yeah, I see that students who struggle with anxiety and depression also struggle with executive functioning because memory is affected by those. When you're nervous about something, it's really hard to remember. Once again, it just doesn't seem to stick. You're going through the motions, but you're not remembering what it was that you read. And that happens whether you're anxious. It also happens sometimes when you're depressed, when you are just not able to get started or initiate. And that's some of that same executive function where it just seems like you don't have the energy to just get out your backpack and go through those steps that you need to do. So I think that both of those things, the anxiety as well as the depression, also impact executive functioning, because it's that final step of putting it all together and getting things done.
Well, Mrs. Howe, thank you so much for joining me today. Is there anything else that you would like to add?
Just that I am always here for students, whether they need someone to talk to vent, or they're concerned about someone else, then I'm here to help in any way that I can, whether they're anxious or depressed or concerned about a friend or struggling with executive functioning and want some ideas of what they can do differently. I'm here to help, as well as our counseling.
Well, thank you.
You're welcome.
You have 2 children with ADHD. What was the most, or is the most challenging part of raising these kids?
I would say the first big challenge is that ADHD presents with so many different symptoms that I thought I knew what it would look like in a child, and I actually didn't. It took years for both of my kids to get diagnosed. In retrospect, it really would have helped them to get diagnosed sooner. Also, ADHD is much more common than the resources to support it. So there was a lot of time spent, waiting for evaluation appointments, tracking down support services, a lot of paperwork, a lot of forms.
Your daughter struggled a lot with ADHD in school, both academically and socially. What are some things that you did to help?
Well, each of my kids had different ADHD symptoms, so they needed completely different things, which was one of the challenges. My older daughter had kind of a classic inattentive ADD and social anxiety combination, and the most noticeable symptom for her was a very common thing from about pre-K through elementary school. It was really difficult to get out of the door in the morning because young children with ADHD have trouble internalizing routines. Every time I told her, it's time to eat breakfast now, it's time to put on your shoes now, it's time to find your jacket now, every day it was a surprise to her. So one thing that we found helpful was to make pictorial checklists. I put pictures of the different steps in our morning routine up on the wall in a couple of different rooms to kind of prompt her and help her follow along. With my younger daughter, the symptoms were completely different. her symptoms actually didn't interfere with school very much at all. But after she was diagnosed, we realized that she actually did lose things pretty frequently, that she had anxiety around timed testing, which are different ADHD symptoms that are also recognized but weren't the same as my older daughter's. In my younger daughter's case, there wasn't a lot that we could do in terms of home supports, although we did help her keep her room organized. By the time my younger daughter was diagnosed, we were more comfortable with the medications, so we went pretty quickly straight to the methylphenidate.
So what worked and what didn't?
So we were fortunate that in the case of both of our kids, extended release methylphenidate was a really effective treatment. ADHD is treatable for most kids, but not every kid responds to the meds, so we were lucky that both of ours did. And then structural supports in place. Because my older daughter was diagnosed so young, we did a lot of pictorial checklists and meeting with the teachers and setting up supports inside the school building and having a designated place for homework and always keeping it clean and clear and having sharpened pencils next to it. My younger daughter was older when she was diagnosed, so in her case it was mostly just adding the medications to other supports that we already had.
Something that you wish you had done differently?
In retrospect, both of my kids could have been diagnosed earlier than they were and struggled with ADHD for a couple of years before they were diagnosed. And in the case of my older daughter, continued to struggle with it for a couple of years after diagnosis because it took a while to get the meds right. It would be so great if there was a way to just screen for ADHD in the schools so that everyone knew very early on when they had it, and to have a better sense of what medications different kids would respond to.
Last but not least, Ms. Greenblatt, do you have any advice for parents who are struggling to help their children through their ADHD?
I would say be patient, keep a sense of humor, and be reassured that the amount of time that the symptoms really cause trouble is limited. It's not going to be a problem forever, Once you find the right routines and the right meds and your kids get a little older and are better able to manage their own symptoms, things get a lot easier.
Yes. Well, thank you so much for taking the time to meet with me. This was very informative.